At least 3 new people have contracted the fatal viral infection in the Congo city of Mbandaka, sparking fears of a spreading urban contagion. The city boasts a population of more than 1 million people and lies only about 80 miles from where a new spate of infections recently broke out. Health Minister Oly Ilunga gravely warned another life was lost to Ebola on Sunday, bringing the death toll to 26. Earlier in May, the National Institute for Biological Research in Congo confirmed a new outbreak of Ebola in the small town of Bikoro, on the shores of Lake Tumba. The recent outbreak of Ebola marks the 9th time the disease has taken a toll on West Africa since its discovery in the 1970s. Just between April 4 and May 17, a total of 45 cases of Ebola have been reported and 14 have been confirmed by authorities. The Ministry of Health of the Democratic Republic of the Congo said most of the infection were contained to the Bikoro health zone, but infections have now spread to Mbandaka. Fears of a pandemic were also heightened when the WHO warned neighboring countries Congo, Brazzaville and Central African Republic they are at high risk of spread. EPA Getahi, the WHO Director General, is confident the Congo outbreak can be dealt with. The WHO said the Ebola outbreak in the Democratic Republic of the Congo has several characteristics that are of particular concern: the risk of more rapid spread given that Ebola has now spread to an urban area, that there are several outbreaks in remote and hard-to-reach areas, that healthcare staff have been infected, which may be a risk for further amplification. The risk of international spread is particularly high since the city of Mbandaka is in proximity to the Congo River, which has significant regional traffic across porous borders. However, a meeting of the WHO Emergency Committee convened by Director General Dr. Tedros Adhanom Ghebreyesus remained positive the outbreak will be dealt with by Congo's authorities. Dr. Ghebreyesus said the outbreak is a concerning development, but stressed the necessary tools to fight the disease in Congo are in place. WHO and our partners are taking decisive action to stop further spread of the virus. Dr. Tedros Adhanom Ghebreyesus, WHO Director General, he said, WHO and our partners are taking decisive action to stop further spread of the virus. Dr. Matshidiso Moti, WHO Regional Director for Africa, added, the arrival of Ebola in an urban area is very concerning and WHO and partners are working together to rapidly scale up the search for all contacts of the confirmed case in the Mbandaka area. Thousands of experimental Ebola vaccinations were shipped off to the country last week, and at least 4,000 have already been deployed on the ground in the capital city Kinshasa. Ebola outbreak, the number of victims has risen to 26 people. The WHO additionally invested a whopping $1 million from its contingency fund for emergencies to target the eradication of Ebola in Congo over the next 3 months. The Ebola virus is endemic to Congo, where it was first discovered. Initial symptoms of Ebola include the sudden onset of fever, fatigue, muscle pain, sore throats and headaches. Later stages of the viral infection develop intense vomiting, diarrhea, impaired kidney and liver function and internal bleeding. Reuters: the recent Ebola outbreak was traced back to the town of Bikoro. The Ebola virus is transmitted through interaction with bodily fluids and infected animals. Add more content to this page. Ebola's mortality rates are a dire 50%. The deadliest Ebola outbreak in recorded history, claimed the lives of more than 11,000 people in Western Africa between 2013 and 2016.